Renal artery stenosis is a condition where the renal arteries narrow, leading to reduced blood flow to the kidneys. This can cause hypertension, kidney dysfunction, and even failure. This video will provide an in-depth understanding of renal artery stenosis, including its anatomy, risk factors, diagnosis, and management, ensuring medical students and healthcare professionals can effectively treat this condition. The renal arteries are essential vessels that supply oxygen-rich blood to the kidneys. Understanding their structure and function is crucial in comprehending the pathophysiology of renal artery stenosis. The renal arteries arise from the abdominal aorta and commonly branch into several segmental arteries. The main function of the renal arteries is to deliver blood to the kidneys, providing the necessary oxygen and nutrients required for renal function. Each renal artery divides further into smaller branches, ultimately forming the interlobar arteries, arcuate arteries, and then the smaller afferent arterioles. These afferent arterioles are responsible for supplying blood to the glomerular capillaries within the nephrons. The renal arteries' role in maintaining renal perfusion and filtration is vital for overall kidney function. Any obstruction or stenosis within these arteries can disrupt blood flow to the kidneys, leading to various complications associated with renal artery stenosis. Renal artery stenosis is caused by atherosclerosis, fibromuscular dysplasia, and endothelial dysfunction. These conditions narrow or obstruct the renal arteries, disrupting blood flow to the kidneys and affecting their normal function. Recognizing these underlying mechanisms is important for diagnosing and treating renal artery stenosis. Renal artery stenosis shares several risk factors with other cardiovascular conditions. Hypertension is a key risk factor, with up to 90% of patients with renal artery stenosis experiencing elevated blood pressure. Other risk factors include advanced age, smoking, diabetes mellitus, hyperlipidemia, and a family history of cardiovascular disease. The prevalence and incidence of renal artery stenosis vary depending on the population studied. The condition is more common in older individuals, affecting approximately 1 to 5% of the population above the age of 65. In younger individuals, renal artery stenosis is often associated with fibromuscular dysplasia. Recognizing these risk factors and understanding the epidemiology of renal artery stenosis are essential in identifying high-risk patients and implementing preventive measures. Additionally, an understanding of the population affected by renal artery stenosis aids in resource allocation and planning for the management of this condition. Renal artery stenosis often presents with hypertension, renal dysfunction, and abdominal brutes. Other symptoms may include flank pain, recurrent urinary tract infections, and episodes of unexplained pulmonary edema. Early recognition and diagnosis are crucial for proper management. Diagnostic tests such as renal ultrasound, renal artery Doppler, and computed tomography angiography, CTA, are used to evaluate renal artery stenosis. These tests provide information on the severity of stenosis and aid in treatment decisions. Renal artery stenosis can be diagnosed using Doppler ultrasound, CT angiography, CTA, or magnetic resonance angiography, MRA. Doppler ultrasound shows blood flow patterns, while CTA provides detailed images with contrast dye. MRA offers anatomical details without dye. Understanding the strengths and limitations of each technique is important for choosing the right one. Angiography, specifically digital subtraction angiography and selective renal angiography, is essential for confirming and characterizing renal artery stenosis. It provides detailed anatomical information, aiding in treatment planning. Differentiating renal artery stenosis from other causes of renal dysfunction is crucial in implementing the appropriate treatment approach. Several conditions can mimic the clinical presentation of renal artery stenosis, such as renal parenchymal disease, for example, chronic kidney disease, and renovascular hypertension. Renovascular hypertension, similar to renal artery stenosis, has hypertension as a hallmark manifestation. However, in renovascular hypertension, the underlying cause is impaired blood flow to the kidneys due to renal artery narrowing or occlusion. Distinguishing renal artery stenosis from renal parenchymal disease, such as chronic kidney disease, involves careful evaluation of the patient's medical history, physical examination findings, and diagnostic test results. Medical imaging, including renal ultrasound and renal artery Doppler, can aid in this differential diagnosis process. Accurate differential diagnosis ensures that patients receive appropriate management strategies that address the underlying cause of their renal dysfunction. This prevents unnecessary interventions and helps optimize patient outcomes. Treatment options for renal artery stenosis include medical management with antihypertensive medications, percutaneous transluminal angioplasty, PTA, stenting, and surgical interventions like renal artery bypass. The choice of treatment depends on various factors and should involve patient input. In summary, managing renal artery stenosis in the elderly and pregnant patients presents unique challenges due to physiological changes and comorbidities. Close monitoring and an interdisciplinary approach are crucial for optimal outcomes. Renal artery stenosis can cause complications like renal failure and cardiovascular events. Prognosis depends on stenosis severity, comorbidities, and treatment effectiveness. Early detection and management are crucial for improved outcomes. Research into renal artery stenosis has led to exciting advancements in treatment. Drug-eluting stents, gene therapies, and targeted pharmacological agents show promise. Diagnostic techniques and precision medicine approaches are also being developed. The future looks bright for improving patient outcomes in renal artery stenosis. Renal artery stenosis is vital for delivering appropriate care. Collaborative management with other healthcare professionals, including nephrologists, radiologists, and interventional cardiologists, is key for optimal patient outcomes. Ongoing research is necessary to further improve understanding and treatment strategies for this complex condition.